remember what everyone was saying? 2020 will be our year. 2020 clear vision. 2020 will be great. It'll be so clear. Everything will be new and fresh because we'll have 2020 vision. New year, new you. It's been a new year, all right. We definitely have a clear vision that everyone's wearing masks. Some of us, not me, are drinking bleach, perhaps. There are others who are going crazy, hoarding toilet paper, hoarding paper towels, hoarding food, doing all types of interesting things. And it's all because of this COVID-19 pandemic. There is so much information and misinformation out there. And today, what we'd like to do is have you to put on your glasses, to get that clear vision, to see what is true and what is false about the COVID-2019 pandemic. Today we have a wonderful show for you. We will start with a personal story of experiencing the pandemic by Shona Bramble. We'll next talk about how we're going to separate the fact and the fiction from Dr. Ena Okah. The lovely Lisa Simmons will be conducting an interactive Q&A session. And we'll also talk about finding and building resilience with Sandra Colesbell. Peter Tan will provide you with COVID-19 resources, and that will be followed with a coaching breakout session for our guests for today. So I hope that you enjoy today's show as we discuss the COVID-19 pandemic, dispelling the myths, and providing you with resources. Now I'd like to turn it over to Shona Bramble, who will give us a personal story. Thank you.
Great, thank you, Danielle. Good morning, everyone. Can everybody hear me okay? Wonderful. Now, this is the first time I've been seen since February, or late February, I think, in the Toastmasters world, so it's really great to be here. I hope that everybody's doing well, keeping safe, keeping healthy. When I was asked to do this, I remember Anna asking me if I thought I was ready to talk about this, because this is something that has happened fairly recently. I lost a family member due to the coronavirus. This person is my second cousin, my mom's first cousin, and she lived in PG County in Glendale. So I'll start with the timeline of how this all happened. My cousin experienced some issues with having a cough and difficulty breathing, and was taken to the hospital on March 31st, I believe it was. And she spent 6 days in the hospital. At first, we weren't really sure what was happening. I heard different information from family members. They said that she had tested positive, but then we heard she didn't, and then we heard she was getting better. And things took a turn for the worse on April 5th. My sister and I had just finished watching the Palm Sunday service on the internet through the Washington National Cathedral. And I had been in contact with her son earlier that day, asking him how she was. And he sent me this very disturbing text back, and he said, well, they're gonna try a few things, and if that doesn't work, then it means that her heart might stop, and there's a no resuscitate clause. So at that moment, me being very hopeful, thinking, she's gonna make it through, she's gonna get through this, she's tough. A couple of hours later, my sister came downstairs to me and she said, Anis passed away. My cousin's name is Anis Crease. And for any one of you that has been keeping up with the news, if you saw a news item in the Washington, D.C. area, actually it ended up being on CNN. She was the second teacher in PG County that passed away from the virus. Anis was born in St. Vincent, where I'm from, but she grew up in Trinidad and Tobago and had moved to the US over 20 years ago. She had been a Spanish teacher at Northwestern High School in PG County, which is actually the school where I went when I came to the US. And so she was very well known. She had a motherly characteristic about her. She was very kind. She was witty. She was smart. She was the first person that I knew in my family that had an advanced degree, and somebody who was about business. The last time I saw my cousin Anis was late February when, interestingly enough, we were attending the first year memorial of her mother's passing last year. And I remember seeing her there at my cousin's house, her sister's house, and she was wearing a brooch on her jacket. And I commented, that was a beautiful brooch that you're wearing. And she said, it's my mother's brooch. And I don't wear brooches often, but I think I'm gonna keep wearing this, until the end of my days. And that's the last actual conversation that I had with her. And my family is a pretty big family, pretty extended family. We hug a lot, we laugh a lot, we eat a lot. And so we're very close. We're extremely close. This has been a very difficult situation for me and my family because, there's no way to see each other, be with each other, comfort each other. And so that's what one of the difficulties are. The thing that hurt me the most, I think, with this whole situation was that she died alone. There was no one there to hold her hand. Her son, who lives in Florida, couldn't come to be here. He has a newborn, and it would have been dangerous for him to come. How does a family cope? How do we cope? It's extremely difficult. Our faith keeps us. We've been communicating more, my immediate family, through texts, Zoom sessions on Sundays to stay connected. We talk about her. We talk about the good things that she's done for her family. And we talk about the fact that, beyond this and after this, that we will celebrate her. We will have a funeral. We haven't had a chance to do anything like that because we chose not to do it with just a few people. We were told that if you do a funeral, it has to be about 10 people. My family is much too large, and our love is much too large. So we're going to wait until this is over, and we will have a funeral, and we will celebrate her life. This isn't the first time I'm shedding tears, so please, it's okay. Crying is actually okay. And I've cried a lot. My family members have cried a lot. The one thing we've done is that we had a prayer meeting on the 13th of April, and we got on a call, and each of us got to pay tributes to her. My mom is a deacon. She was able to say different prayers to comfort us, to comfort each other. It's difficult when people ask me, what can I do for you, Shona? It differs from day to day. What I ask for is prayers for not just me, but for my family, for her family, that we're able to be with each other and comfort each other and remember her in the way that we know as a family. I am comforted by friends and family who have reached out to me in different forms, different formats. Some days are tough. Some days I just think about the situation and I wonder why I can't just get up and go. and hug my mom or hug my grandmother who's 86 years old and is doing well so far, thank God. So how do we move forward? How do we move forward through this difficult time? I think hope is the word that comes to mind. Hope that this virus will disappear, or at least will become something so small that we can manage it. I work for AstraZeneca, for those of you that don't know this, and they're currently teaming up with Oxford and other partners to work on different things for COVID. So I feel some comfort in that, knowing that there are organizations such as AstraZeneca and others who are putting their time, effort, and money into finding vaccines or medications, whatever it is. I was one of those people, Danielle, who was thinking about 2020 being this vision, being this light, and being something memorable. And it started out very dark, very, very dark. But to keep myself together and to keep myself fit to go through this experience, I've turned to meditation more frequently every day. I try to meditate in the morning before I start my day. I try to get in some exercise at the end of the day, a few days of the week. That helps my mental state. We need that. And I actually do watch what I eat, because I think at a time like this, we tend to go into a mode of, eating a lot of food and comfort eating and things like that. But, it's really important for each of us to really, make sure that we're taking care of ourselves in a healthy manner. I've been in self-isolation since March 16th. The only person I've seen in person is my sister. So the isolation has helped to give me a chance to cope and to get through the situation. But at the same time, I miss the hugs and interaction with my friends, my family, my Toastmasters members. I haven't been in Toastmasters meetings since February myself, so I look forward to returning at some point. I want to close this out by saying that for anybody who has experienced a death, or knows someone who's experienced a death, it's difficult. It's a difficult situation to be in. It's unusual, and I don't know how we comfort ourselves. It's just through faith that we comfort ourselves, those of us who've been directly affected. And so I just want to really just stress to everybody to just be safe, be healthy, listen to the experts, the medical experts, because you don't want to experience this and have to go through this not being able to be close to someone that you love and care about. Hold people close to you, say you love them, be understanding. Just put out that wealth of love that you have within you now, because you just never know. I didn't know that the last time I spoke to my cousin Anis, that would have been the last. And I'm happy that I was able to hug her, greet her, and share some funny stories with her. And most importantly, just say I love you. I think that's important for us to keep doing with the people that we love. So I just want to leave you with that, and continue to be safe, continue to be well. Thank you.
Thank you so much, Shona. That was definitely a very wonderful story about your experience. So we definitely appreciate you for sharing that with us. Next, we will have Dr. Ena Okah, who's going to share with us some information about COVID-19, and she's going to help us with separating fact from fiction. Ladies and gentlemen, I present to you Dr. Ena Okah.
Hi, everybody. All righty. So I'm going to ask Maylene to please share the screen so the PowerPoint can come on, and we're going to get started. what I really want to do with this session is just share with you the basic health information about this virus, but I want to spend the majority of the time, honestly, in the Q&A, because I feel that that's where I can best help everyone who's on this call to give you very valid information about this virus and all the myths, as it were, that we have about it, try to help us move past some of that. So let's get started. Next slide, please. All right, so the first things first is the official name of the virus, even though we call it COVID-19, the medical name is Severe Acute Respiratory Syndrome Coronavirus 2, also known as SARS-CoV-2. And the reason why this is important is because some of us will remember the SARS outbreak that happened years ago. And so this virus is related to that virus, but it's completely different at the same time. The first known cases were reported in Wuhan, China in December, but in all honesty, the more we're learning about this virus, the more we realize that it was around much longer than that. The first known cases probably happened in the fall, early fall for that matter, and they likely happened all over the world. We just didn't catch it. And so we've not been able to zero in on what we would typically call patient zero, which is the first case, but it's very highly unlikely that the first case was in December in Wuhan. The first case was likely much earlier than that. It's a virus that is originally, we're still on that slide. It's a virus that originally starts in animals and had a bycross into humans, which can happen through food and a bunch of other activities that we have in common with animals. It's a very new virus, as I said, so there's so much about it that we don't know, but there's also more information that's coming to us by the day. Let's move forward. All right, so let's talk about the spread of the virus. The most common way that this virus spreads, as I said, is an infection from one person to the next. Of course, you can also get it through inanimate objects. I'm talking about it being left on surfaces, but even on the surfaces, it gets there because somebody has released either droplets from coughing, talking, sneezing, etc., and that can live on surfaces for as long as days, essentially. So that's typically how you get it, either direct contact, so somebody who speaks or sneezes or coughs, or they cough, sneeze, talk on an object, and then you get into contact with that object. I should also mention, we don't typically think about this, but it's also a virus that can get into your system through your eyes. And so for individuals who use contacts, something to be very mindful of. If you're constantly maneuvering with your eyes, so that's another way that you can get the virus. Next slide, please. All right, so let's talk about the symptoms. And I think this is where a lot of the confusion rests, as well as a lot of the panic. So you'll see people who will just have a little bit of a cough and just go into a mad panic thinking that they have COVID-19. And so let me just talk about the symptoms. Some of the more serious ones are people have fever. So I'm talking a fever that's upwards of 100 degrees Fahrenheit. Individuals will have sore throat and to the point where sometimes it's difficult to even swallow anything. Coughing, shortness of breath, body aches is fairly common these days. And some individuals might also have gastrointestinal problems. So we're talking diarrhea or vomiting or even having difficulty and just having abdominal pain. That has also been something that we've seen. I want to mention two things about the symptoms that are atypical symptoms that we've not seen in other viral cases. So the first is the loss of smell and taste. Very atypical to be associated with a viral disease. We almost never see that, but that's something that has been fairly common with COVID. I will preface this by saying that you don't always have the loss of smell or taste, so don't think that if you don't have that, then you don't have COVID. But there's been more cases of that. We've also noticed that individuals have had symptoms that mirror like a stroke, especially in younger patients. So by younger, I'm saying people who are under 50. And it feels like they're having a stroke. So they're having shortness of breath, they're having difficulty breathing, they feel like there's a weight on their chest, and it just feels like they're having a stroke. But unfortunately, for several of those patients, it has not been a stroke, it's just been the COVID-19. Generally speaking, the symptoms start a few days after exposure, and they can last as long as 14 days. I know we've had that mindset of I quarantine for 14 days and I'm okay. I should just mention that it's possible to be asymptomatic for much longer, and by that I mean show no symptoms. So there are individuals who can be asymptomatic for weeks, for months, and show nothing. And because they're showing nothing as they're interacting with other people, of course, there is that potential of them spreading the virus to them. Some individuals also have no symptoms. I had a colleague about 3 weeks ago who was not showing any symptoms at all, but because there was routine screening of everybody at work, that's the only reason why we realized he had COVID. So there's also the possibility of people walking around, no symptoms at all, and they have the disease. Let's move on. All right. As I mentioned before, because viral infections are perhaps the most common human infections that we have, it's what causes the flu, sore throat, pneumonia, if you have viral pneumonia, and several other conditions. The symptoms are very similar, and so the treatment is also fairly similar. But because this virus is so new and we don't know as much about it, we are almost learning on the go the best way to treat it. There is no specific treatment, and what I mean by that is there's no vaccine for this virus. What we are doing is symptom management. So if you have respiratory symptoms, we're working on dealing with your respiratory symptoms. If you have gastrointestinal symptoms, I'm talking diarrhea, abdominal pain, whatever we're giving you is to deal with the symptoms. So we're truly in symptom management mode in the sense that we don't have a vaccine that actively treats this condition. Let's move forward. Now I'm going to talk a little bit about the prevention, and I will say for everybody who's on this, you will get the slides if you wanted, so you don't have to feel a need to try to write down everything. But the first thing is obviously good personal hygiene. So you want to think about hand washing, you want to think about using protective equipment, you want to think about making sure that you're being very conscientious of what you're getting in contact with during the season. If you're coughing or you're sneezing, you want to make sure that you're covering your mouth and not exposing other people to anything that you may have or not have. And so it's really important that we keep in mind that. I will also say that I've seen a lot of people who will sneeze or use a tissue or something like that and then store that tissue close by them. It's almost as though the purpose is defeated. And so you want to make sure that you're disposing of things correctly and appropriately for your own safety and for the safety of others as well. Very important that you avoid touching your face. This one I think is very difficult for a lot of us because as we're talking, we're touching our face, moving our hair out of our face, etc. But this is one of those seasons where you have to be very conscientious about touching your face, touching your nose, touching your mouth, because you're getting into contact again with different objects. And so by touching those orifices, or essentially those portions of your face where the virus can come in, you have that potential of essentially harming yourself, or at least raising the risk of doing so. So you want to be careful of that. This other one is very difficult for a lot of people, but we have to stay away from people who are sick or seem like they're sick. Even if there's been no confirmation of COVID, if someone is showing any of the symptoms, it is wise to stay away from them. And similarly, if you are showing the symptoms, it is wise for you to stay away from others until you have the opportunity to be tested or self-quarantined and shown to not have the condition. So you want to think avoiding shaking hands, etc. Suffice to say, this does not apply to the people you're quarantining with currently unless you start showing symptoms at home, in which case self-quarantining at home might be necessary. I've heard a lot of people speak about getting the flu shot as a preventative measure. What I will say is that the flu shot tends to confer immunity or pseudo-immunity to several viral conditions, which is why you're always encouraged to get the flu shot, so that even if there's a new strain of the flu, you're better off than someone who didn't get the flu shot. With that said, because this virus is different, it may help you, but it's certainly not a way to prevent you from getting the virus. All it will do is, if and when you do get it, it gives the likelihood that there will be less severe symptoms. Okay, let's move on. For anybody who feels that you are not well, my encouragement to you is not to travel. You don't want to move around because you run the risk of exposing yourself and others to this condition. I will also say too that generally speaking, when you have a viral infection, your immune system is not working at its optimum. So if you do travel and you unfortunately get exposed to other things that are not even COVID, you raise the risk of having additional infections that have nothing to do with the COVID, which places you at a worse health situation. So you want to be careful not to travel. I mentioned before, make sure that you cover yourself when you sneeze, when you cough, using a tissue, using a mask, washing your hands with soap and water, or using a sanitizer. I encourage anybody who feels any of the symptoms to seek medical attention immediately. Call your primary care physician, or you can also come into the emergency room. But I will caveat that by saying that call your primary care physician first. And a lot of the states and cities also have emergency hotline numbers you can call. I would encourage you call before you come into the emergency room, just because some emergency rooms are having very high traffic. And so if you come in prematurely, there's always that issue of not seeing a physician on time or not even seeing one at all. So something for you to keep in mind. Next slide, please. Screening. This is one of the questions that keeps asked over and over again. How do I get screened? When do I get screened? There will be a detailed conversation on resources, which will talk about where to get screened. However, I will talk about thinking about whether you should go in for screening. If you're having respiratory symptoms, it's very important that you go into, you literally bypass screening and go straight to the hospital and just see your doctor. I would encourage screening if you're having cough, continuous cough, sore throat, having that issue of loss of taste or smell. That's a good time to consider getting screened. Several different cities have different methodologies to you getting screened. And so for DC, for example, I know that you will not be screened essentially if you don't have a fever, if you don't have respiratory symptoms, or if you don't have loss of taste or smell. And the reason is very simple. There's a shortage of screening capacity. And so to some extent, there's rationing to allow the people who we believe are the sickest to get screened first. That way the test kits are not put to waste, or so to say. Also important to remember that your health authority in every single city and every single county is putting out information on a regular basis to tell you what it is that you need to do. And so it's important that you keep up to date with that information, that you're checking what the health authorities are saying, and that you're following those instructions that they're giving. Next slide, please. All right, so this part, I think for every single one of us, we are probably all thinking, when is this ever going to end, if ever? And my encouragement to you, I'm just going to share some tips, and our experts in mental health will get the opportunity to delve more into this. But I really want to encourage everybody, take information breaks. What I mean by that is, don't be listening to CNN or any other news outlet, Fox, MSNBC, etc., continuously all day, because you're going to be overwhelmed. It'll make you stressed and make you very nervous about the situation. And so my encouragement is pace yourself and have a cadence to how often you listen to information. For me, I have a routine. I listen to the news on this maybe 10, 15 minutes a day, or 10, 15 minutes every other day, depending on if we're getting new information. And that's it, because I don't want to be overwhelmed. I don't want to be stressed. I don't want to be paranoid about the situation. I encourage you to spend quality time with your loved ones, so your friends. It doesn't have to be people who are in close proximity. If you're quarantining alone, which is the case with a lot of people, try to find what I call your tribe or your herd. And these are people who you love and that love you, and try to have FaceTime with them. Try to have video conferencing opportunities. You just want to make sure you're actively engaging with other people. Go easy on yourself. I've seen a lot of people making very dramatic plans this quarantine. I'm going to write my whole book. I'm going to learn this new skill. I'm going to learn a new language before this is over. And when they see that they're not really making the progress they get disappointed. And so my encouragement is go easy on yourself, because this is a very difficult time. And so if you're not assimilating information that you thought you would as quickly, don't be so hard to judge yourself because of that. I encourage you to schedule me time. For people who know me pretty well, I've had a long-standing tradition for many years where Sunday is my me time, and I try not to do anything. And I've kept it through this Corona moment. And my encouragement to every single person is try to find a time, whether it's a few hours a day, particular day of the week, where it's just your time to recenter and regroup and process what's happening. And then finally, manage your energy, not just your time. And that's going to segue into the next slide. Next slide, please. Okay. Our sources of energy typically come from 4 places. So we have our physical energy, which is literally the energy of your body. You have your emotions, which I like to refer to as the quality of energy that you have, your mind, which is where your energy focuses, and then your spirit, which is truly where you find meaning and purpose. So when I say manage your energy, I'm saying manage these 4 aspects of your life. So manage your physical energy, make sure you're getting enough sleep, you're eating correctly, you're doing actual exercise during the season. This is not a season to just atrophy and stay at home and be on the couch, but once in a while try to walk around, try to do, if you do yoga, do that. If you do Pilates, do that. If you do weight training, whatever it is that you can, if you can just take a walk around the block, it really doesn't matter, but make sure you keep your physical body going during this. You want to make sure that you're conscientious of who you're letting into your space and your emotions. So that's the quality of your energy. With your mind, you want to make sure that there's not too much clutter. Again, when you're dealing with something that's unfamiliar, there's a way that our mind wants to absorb so much information. And when there is an excessive pool of information, there is a way that unfortunately the result is that your mind shuts down and gets cluttered. And so you want to be conscious of the energy of your mind. And then finally, when I talk about your spiritual energy, I'm not necessarily talking about your religion, but if you're a person of faith, that's maybe somewhere where you draw that energy. But even if you're not of a particular faith, or don't even believe in an existence of a spiritual being per se, what I want to encourage you to do is think of the things that give your life purpose, whether it's your work, whether it's the people that you love, and try to figure out ways to connect more with that during this season. Next slide. All right, so we're gonna move into the Q&A. I'm just gonna wrap up by saying that this is a very new virus, as I said before, so there's so much about it that we don't know. There's so much about it that we're still learning, and we will continue to learn. And so my encouragement to everybody is when you hear information and it feels like the information is changing or switching, it's not that the experts don't know what they're saying. It's just the reality that we are learning more. And so as we learn more, the information is becoming clearer and more acute, and as a result of that, there might be things that we thought before that we know differently about now. So now we're going to move on to the Q&A, and I will be introducing Lisa Simmons, who is going to be facilitating that session of asking me questions that I believe you have from the chat.
I do. I have several questions for you, Ena. Before you begin, I know you may not have had an opportunity at the beginning, but can you state your professional background and your credentials?
There you go. So I have dual doctorate degrees, one in public health and the other is a routine medical degree. My focus area is on oncology, but as anybody knows, and if you don't know, because of this crisis, a lot of people, regardless of where your specialty is, you're being rerouted into emergency care or critical care, just to help deal with the burden of individuals coming into the ICUs or to the EDs or to the hospital as a whole.
Excellent, thank you. So let's ask you a few questions just on fact. Is there any cure for COVID-19?
No, there is no cure. And I hate to have to say it this way, but there's not actually going to be a cure. What we will find is a potential vaccine, which is not the same thing as a cure. What a vaccine does is it confers immunity to you so that if you get exposed to the virus subsequently, then your body is literally already prepared to deal with it. And what a vaccine is, honestly, is a less potent version of the virus. So it's the virus given to you in a form that we call attenuated, which just means that it's either dead or less potent. And it forces your body to basically make the antibodies, which is your body's defense system against a virus. And so when you actually get hit with a virus, your body has already has a muscle memory of making those antibodies. So it's able to respond quicker. But for now, we don't have a vaccine. We definitely don't have a cure. All we have are essentially symptom management medications that we're using.
Speaking of symptom management medications, there's been a lot of questions about bleach. Will drinking bleach or injecting it into your system kill the virus within your body?
No, the only thing injecting bleach will do, honestly, is damage the walls of your intestines, damage the walls of your stomach, damage the walls of your throat and your esophagus, and just a no. There's no wisdom to drinking bleach. There's also no wisdom to washing any part of your body with bleach either, because I've heard that as well. Should I wash my hand with bleach? It's a no all around. Bleach is just that. It should be used on clothes and for cleaning and not for any kind of medicinal purposes.
What about aspirin?
In terms of aspirin, the reason why that has come up is because for the individuals who are having stroke-like symptoms, aspirin, low-dose aspirin, as we all know, helps with a heart attack or with a stroke. And so I've seen people saying, well, should I take aspirin as a preventative measure in case I get the COVID? And here is my advice. On the one hand, taking aspirin continuously makes you more prone to bleeding. If you already have underlying conditions, aspirin can cause you to have an increase in your blood pressure. It can cause you to have an increase in your heart rate. And so I don't advise anybody to take aspirin as a prophylactic waiting for the onset of COVID. If you are already on an aspirin regimen, that's completely different because you clearly already have some form of a cardiovascular heart issue. But if you don't, I would not encourage anybody to just go to the pharmacy and get aspirin and start taking it.
I know I'm going to butcher this name because I've heard it, but I have not pronounced it prior to this meeting. But a lot of us have heard from Dr. Fauci and talking about remdesivir.
Yeah.
Can you talk about that as a potential cure / symptom management medicine?
Right. So it's currently being used as a symptom management medicine, and that's what we will continue to use it for. As a preface to explain what that drug is. So that drug was made years ago when we had the Ebola crisis. And it was one of the medications that was made as an option to potentially help treat Ebola. However, it did not work well in Ebola patients at all. But since this COVID crisis happened, a lot of the pharmaceutical companies and even the NIH and several other national entities have been going back to essentially our catalog of medications that were tried out for viral infections, but didn't really work well. And this is one of those medications. I will say, though, that it has been shortening the duration of symptoms for some patients, not for everybody, but there's not enough evidence. So the two places that has been looked at was the larger cohort in Mount Sinai of about 250 patients or so. And in that cohort, the majority of them did have a shortage of the duration of their symptoms. On the flip side, though, when they looked at similar patient profiles at Mayo Clinic, there wasn't a significant improvement. And so it's too early to essentially put a stamp on that drug and say, this one is the one. We need more information. But for now, it's definitely being used for symptom management, especially for people who have respiratory distress.
There's a lot of information that's coming out almost hourly about the disease. Who are you trusting for information right now?
Dr. Fauci. I'm looking at the medical experts. I'm a medical expert myself, and I'm looking at other medical experts. I'm not looking at politicians. I'm not even looking at philanthropists, quite frankly, because unless you're a philanthropist who also has the degree to back it up, it's not good enough for me to listen to you. And so my encouragement to everybody is listen to Dr. Fauci. Listen to the medical experts within your local communities, because they will give you the facts, the medical facts as we know it. They're not going to give you assumptions or hope. Hope is good, but this is a situation where we have to deal in facts. And so we can't just be hopeful about what might work. It's good that we hear what is actually working.
There's also been some news about convalescence plasma. Can you talk about what that is and how it might help with the treatment of the virus?
Essentially what that is say I got the virus, and I had mentioned earlier that your body's natural response is it'll make antibodies to that virus. And so the idea is for someone who's had it and recovered and their body has already made antibodies to the virus, can we harvest those antibodies and essentially give it to another person? So we harvest it within the plasma, because we cannot just harvest your antibodies randomly. So the fluid that we pull out is literally called plasma. The problem, if there is one, with that is if I have any other underlying issues that do not agree with your system. So say, for instance, I have, and this is just a random thing I'm throwing out, if I had, say, another bacterial infection, say I had strep throat, for example, and I had streptococcus also roaming in my system. If we do use convalescent plasma for you, Lisa, for instance, not only would you be getting the antibodies for the virus, you would also be getting essentially my strep throat bacteria while you're at it. And so that's the problem with convalescent plasma, because we have to do a screening to make sure that the person has no underlying conditions before we give it to another person. And it's not fail safe. It's really not. It works for some people, and for some people it doesn't.
If someone tests positive for antibodies, does that mean that they're contagious to others?
Not necessarily. What it means definitively is that you've had it at some point, whether you have an active infection right now or not. The only way we can know that is through what we call a PCA assay test. That's the test that actually shows us whether there's an active infection going on right now. So doing the antibody test, all it tells us is that the infection existed at some point, but we don't know if it's actually active in your system right now.
Okay. Does it mean that the person is cured, that they will never get the virus again?
Not at all. Just like the flu. I can have the flu today and have the flu again next week. It's exactly the same thing. You can have COVID and have a reinfection. You don't even have to be exposed to another person. The COVID that's already within your system literally can essentially have a surge or a reemergence. And so it's not a one and done for all type situation. There's always the potential of reinfection, either based on what's already within your system or you getting in touch with somebody else who has it.
If you have antibodies, are you able to donate your blood for vaccine trials?
Absolutely. So the NIH, the CDC are the big ones that are in the process of essentially trying to run drug trials. And one of the trials that they're running is in fact the antibody based trial to see whether individuals who've had it before, their antibodies can be harvested and essentially mass produced and used as a form of treatment. So you can definitely go to the NIH's website. It's nih.gov. You'll get information there, or cdc.gov, and you'll get information on all the ongoing or upcoming clinical trials.
What type of data have you seen around the virus in pregnant women?
So two things I will say about that. The first is that we've seen situations where the mother is COVID positive and the infant or the newborn does not get it. We've also seen very odd situations where the mother is COVID negative and the newborn has it. In those situations where the mother has it and the child doesn't, it's usually just a situation of, it's a stroke of luck, essentially. What I mean by that is when you're pregnant, you're literally sharing blood with your infant. That's how, there's no other way for me to say it, because the placenta, which is how the baby gets food from the mother, anything can cross there, including viruses. But in some situations, it just doesn't. There's no method to the madness. It just doesn't. And so that's what we've seen in some babies. But on the flip side, like I said, there are mothers who have tested COVID negative. And what that shows us really is two things. Number one, the mother does not have large enough of a viral load for it to be picked up by the test. So it doesn't mean she does not have the virus within her. It just means it never manifested in an infection. But for whatever, and not for whatever reason, because children, literally their immune systems have not been well developed. They don't have antibodies like we do. The only antibodies they have are their mothers. And so it's a very small profile. So it's easy, very easy to catch it in a newborn.
Another segment that there doesn't seem to be a lot of data on is how the virus impacts the African American community. There have been a lot of anecdotal quotes or sayings, I guess you could say, out there that African Americans are being affected more by the disease than any other race. Based upon the data that you've seen, is that true? And if it is, could you speak as to why African Americans are more vulnerable than other communities?
So two things I will say. It's not that African Americans are more vulnerable. What the data is actually showing is that two things. Number one, African Americans are having higher death rates, which is not the same thing as being more vulnerable. It means that more people who are of African American descent are presenting to the hospital and essentially dying from COVID-19. But if you look in the larger populace and do just a ratio activity of the ratio of African Americans having it to the ratio of African Americans in the population, there's really nothing that shows that there's a higher risk. Does that make sense? And so
Yes.
The real issue is two things that we're looking at. One is just the issue of literally being underinsured, not having the healthcare resources. And so when people have symptoms, they don't want to go into the hospital because they're thinking of the medical bill. And so they're trying to wait it out to see how bad will it get before I present. And so what we're seeing with a lot of, and it's not even just African Americans, with a lot of minority populations, quite frankly, is that there's delayed coming to the hospital. And so by the time a lot of them come, some are already in acute respiratory failure before they even present. So that it really just raises an underlying systemic issue that those communities don't have enough healthcare to begin with, basic healthcare. And so most do not have a primary care physician that they can just call and say, I have these symptoms. Can you basically triage through telehealth for me? Whereas individuals in certain other communities have better access to that. So it's really more, it's a socioeconomic issue. It's an underinsurance issue. It's a lack of primary care issue. That's really what it is, more so than greater risk of having the COVID-19.
Before we go into our next topic of questions, I just want to let everyone know that I am getting your questions. If I accidentally ignore you, it's only because I have multiple questions coming in at the same time. So continue to send your questions in. So Ena, let's talk about symptoms and underlying conditions. You spoke earlier about people who show no symptoms or signs of being sick. Will those people ever show signs that they are sick?
Not necessarily, much like the flu. A lot of people during flu season walk around with the flu. They have no clue. And flu season will pass and they still have no clue that they had the flu. The only reason they would ever know is if they got screened and tested. And this brings me to the next thing, which is a priority and a concern for a lot of healthcare professionals. How can we scale up testing into the communities where it's not a thing where you get tested because you are sick or you get tested because you have symptoms, but to have enough broad-based testing where we can test the majority of the community essentially. And so what we've seen with countries who've really had a downturn, like Norway, like South Korea, it's really that mass testing and contact tracing that has helped them, because a lot of people just don't always present with symptoms. But the problem is they can get in touch with somebody who is either vulnerable because they have pre-existing conditions, or younger or older, etc., and as a result of that, essentially pass on, the infection to that person without even realizing they had it in the first place. So there's a lot of push for an increase in screening, so we'll see, fingers crossed, where that goes.
A lot of my friends are asthmatics. And there are a few people in our participants listing today that are asthmatics as well. Okay. We've heard about asthmatics or shortness of breath being a common symptom. Mm-hmm. What advice do you have for asthmatics? Just in terms of not panicking, or right, what type of medicine they should be taking, etc.
So the first things first is, usually if you have asthma, you're on a long-term treatment that you receive. Either you're getting a bronchodilator. There's a long-term treatment that you're probably on. That's your everyday treatment. So you take it every day or take it every month, depending on the actual regimen you're on. My encouragement is keep taking your regular asthma medication. This is not the time to skip. If you do know, which a lot of people with asthma and have had it for a long time, you know the things that are your aggravating factors. For some people, it's pets. For some people, it's dust. For some people, it's pungent smells. If you know what your aggravating factors are, this is the time to avoid those. You don't want to, because it's twofold. One, when you do have an asthma attack, it literally opens up your respiratory system to other things. And so we want to minimize even having any kind of exacerbation at all during the season. So it's really important that you take your long-term asthma medications as planned. If you do have any kind of shortness of breath, reach out to your primary care physician. A lot of doctors are doing telehealth, so they can have a quick telehealth call with you to essentially triage to see, is this just your regular asthma, or is this presenting as something completely different?
For those who have a genetic predisposition to blood clots, should you take blood thinners?
No, I would not encourage, and I'm going to explain why in a second. Because we don't know enough about this virus, a lot of the medications that we're trying are novel medications. So I'll give you an example. I think a lot of us have heard about the quinine drugs being used during this season. And one of the side effects of the quinine family of drugs is that they have a very interesting tendency to raise the risk of blood clots. So what we don't want is for you to be taking something because you think you're preventing something, and then if you do show up in the hospital, the medications that are available to help you, essentially we can't use them because we find out you've been taking something over the counter. So my encouragement is, take the medications that you routinely take, but don't introduce new medications into your regimen that are not prescribed by your doctor.
Excellent, excellent. We've heard that people with diabetes or high blood pressure are at higher risk than other segments of the population. What advice would you give the people who have underlying conditions to help them manage their health during the pandemic?
So this advice is for diabetes and hypertension, but for anybody who has any underlying conditions. For those who have diabetes, the first thing I will say is, because of the way the nature of this situation is, we have a habit to just start eating anyhow and forgetting the practices that you already put in place before. So my encouragement is, follow, if you're on the DASH diet, which several people who have diabetes might be on, make sure you're following your routine diet. This is not, I know we're cooped up and people are cooking a lot of food and just doing the most during this season, but it's important to stay with your dietary regimen. If you're already on medications for diabetes, continue taking your medications, whether it's insulin, depending on the type of diabetes you have. For those who have heart-related conditions, my advice honestly is manage your stress levels during this time. Take your medications as prescribed. Very important, because you don't want to do anything that essentially sets your body off and puts you at risk for being infected. And this advice is probably also for everybody too. Managing stress is important, because when your stress levels are high, what your body does is literally it'll start shutting down your own immune system. And so you are less capable of fighting viruses the way you would normally, which is why we've been emphasizing managing stress during this COVID pandemic.
We are in the midst of allergy season, as I can tell over the past week. And with allergies, people start to get a little anxious because they're exhibiting the same symptoms sometimes that you might exhibit during, if you have the virus. How do you differentiate between whether you have a cold or suffering from allergies versus you're exhibiting symptoms of the virus?
So it's flu season, and it has created what I like to think of as the perfect storm. So for the last 2 weeks, people coming into the hospital, half of them have the flu, nothing more, nothing less, or they have allergies, but just the fear, the panic. And so the first thing I tell everybody is don't panic, literally don't panic. Check if you have a fever, because people who generally speaking have allergies, you don't typically have allergies together with a fever for the most part. The flu maybe, but allergies, you're not going to have a fever. It's just going to be, the respiratory stuff. That's it. And so if you're having a fever, then that's reason to be concerned that this might be a little bit more serious than my routine allergies. But if it's just your usual sneezing, coughing, no loss of smell or taste, no temperature, no chest pains, you probably just have your routine allergies that you've had for decades. There's probably nothing new going on with you.
Next topic of questions is around cleaning.
Okay.
Groceries. I have been a little reticent to purchasing fresh fruits and vegetables. I actually had to break down and buy onions. And so I am just really concerned about eating fresh fruits and vegetables. So if we do buy them, how should we clean them? Is it okay to clean them with regular products? Is it advisable to get them in canned varieties? What is the best way around fruits and vegetables?
So it's one of those catch-22 questions, because there's no way to get fruits and vegetables without the reality that other people have probably touched your fruits and vegetables before you got them. So let's just start that off with a basis. So if you're afraid of the contact, I would probably ask you to just get canned products and call it a day. But if you're someone who you're so eager to have your fresh fruits and vegetables, here's my advice. When you bring in your fresh fruits and vegetables, first things first, when you get it into your house, get it washed pretty much immediately before you put it into your fridge. My encouragement is just get a bowl, get some water, get some very, very light detergent. And I mean literally your dishwashing detergent, like your Dove or whatever you use. Just a little bit. I'm not talking about making suds of soap, just a little bit. We don't even want to see the suds. If you're seeing suds of soap, you've put too much. And you're going to use that and essentially just let the water run through your fruits and your vegetables. That's my advice. For individuals who you tend to go grocery shopping a lot, I always encourage, because of this situation, when you bring in your grocery store, have a plan for how you unload your groceries. I've seen people who will just, and patients that is, who will just say they brought their groceries, they just put it on top of the table of where they eat and where they. No, let's have a plan. Let there be one specific place in your kitchen where you do grocery unload, and you unload all your groceries into, either you unload it into a basket or a bowl or something like that. Then you wipe off everything before you stack it in your house. Even if it's dry products, don't bring in your dry products and think, oh, it's dry products, who cares? Because you might be bringing something into your home. And so you want to make sure that you wipe down everything that you're bringing in. and then wipe down the surface after you finished your unloading of your groceries as well.
What about deliveries, whether it's through Amazon or we have our groceries delivered to us? Anything different that we should be doing there?
Absolutely. So same thing, when you get your box of groceries, don't just be excited and bring your box straight into your kitchen or your living room or your room or anything like that. Make sure you disinfect your box before you bring it in. I am encouraging that if you have a space in your house, like even if it doesn't even matter if you're in an apartment building, have a space up front where you kind of just put your delivery products. And so there you can get out your product. Hopefully you're wearing gloves while you're doing this activity. You get out your product, you disinfect, and then you get rid of the box. So you're not bringing the whole box into the house. If you do have a home and you have a garage, this is of course a little easier because you can just quarantine literally your garage to be your product unboxing area of your house, and you don't just move things up and down because you don't know where the box has been, you don't know who's touched it, you don't know anything before you got the box.
Someone had a follow-up question to what you just asked. And I'm just going to read it out loud here because I haven't had time to fully process it. Do you really need to wash them before putting them away? Won't the virus die after a while? She typically brings all of her groceries into the laundry room, wipe them down there, and then she brings them into the kitchen and into the refrigerator a day or so later.
My encouragement, honestly, is to wash it. Even if you want to keep it out for a day or two, still wash your products. The idea of how quickly the virus dies off is a question that we're still trying to figure out. What we do know is that the virus, as with any other microbe, will die on contact with essentially soap or alcohol or things of the sort. And so that's the reason why we say disinfect it or wash it. And contrary to popular belief, honestly, soap is the easiest and most effective way of getting rid of all viruses, quite frankly, which is why I encourage just a little bit of soap. Again, no suds, nobody's asking for you to put your food in a bath of soap, but just a little bit to wash it off. I will just say that we have maybe about 5 more minutes of questions. So if anybody has any more questions, feel free to, once we are at the 5-minute mark, you can always send me your questions offline and I'll do my best to answer them.
We're now going to go into quarantine questions. Is it okay to go out? For example, if somebody wanted to go to a state park to get fresh air, is that okay?
It's okay to go out to get fresh air. I wouldn't go to the state park though, only because you don't know the volume of people you might meet at the said park. So unless you are sure that your park is going to be empty and that you can control the distance of everybody at the park, which you can't because you might be walking and a random person just decides to come next to you. There's nothing you can do. And so my encouragement is go outside, but go outside in spaces where you literally have control on how close or how far away you are from people. So if you decide to take a walk on the street, for instance, if somebody's coming, you have the option to literally move aside and let them pass by you. But the problem with going to parks, especially if they're enclosed parks and smaller parks, you really can't control the traffic. You don't know who's coming. You don't know how many people are coming.
We hear a lot about washing our hands, but we don't hear much about hand lubrication. How important is it to keep your hand lubricated during the pandemic?
It's important to the extent that you don't want to break your skin, because if your skin is dry, there's the opportunity for tears and cracks, which gives more opportunity for the virus to essentially get into your hand. So you don't want to have cuts on your hand. And so that's the reason why as soon as you wash, making sure that you're lubricating your hand is important. So that's my encouragement to everybody. Wherever your wash products are, there should be some form of a lubricant right there. The same goes for individuals who are using alcohol-based hand sanitizer. When you use it, you should moisturize shortly after, because the alcohol does dry out your hands, which can make you prone to actual cuts or micro tears as well.
Now I'm going to talk about transmission of the disease. One of our participants heard that handshakes can transmit the virus. How does that happen?
Essentially, it's like with, I want you to think about the virus as like a paint. So if I had like yellow paint on my hand and I give you a high five, a little bit of the yellow paint is on your hand, and then you give Lisa a high five, a little bit of it is on her hand and downwards. So it's kind of the same premise. If I have the virus or if I've been in contact with it, for instance, your contact with anything around me, whether it's my hand, which the same thing goes for hugging as well, or any kind of physical touch for that matter, you raise your chances of being exposed to the condition. So that's the reason why we're saying, because there's so many people who we know for a fact are asymptomatic walking around, to just be on the safe side, don't make contact except for the people who you're quarantining with until this is over.
I have 3 more questions. Are there people whose immune system in such a condition that it will prevent them from contracting the virus?
I wouldn't say prevent, just because there's almost no such thing. The only thing that prevents you from getting a virus is a vaccine, essentially, or reduces, even that is not even 100%. So what I will say, though, is that the stronger your immune system is, the more your body has the capacity to respond to it and for you to recover. I should also mention, too, that one of the things that's really interesting about this particular virus is how small it is. And viruses, we all know, are small, but this one is much smaller than your typical virus. And the problem with that size issue is that most of us, our bodies have not been exposed to a virus that small. So our bodies don't necessarily immediately intuit that this virus should not be there. It almost feels, for most people, your body almost reads it as though it's one of your own proteins in your body just moving around. And so a lot of us, our body is not flagging it immediately that this is not an innate substance that should be there. And so that's why the response has been what it's been for a lot of people. Interestingly enough, people who have more incidents of the flu seem to actually be responding better to this, because their body has been almost training by having so many viral infections over the years. And so they seem to have a much quicker alert system, as it were, than people who almost never have the flu. And your body is just not flagging it as anything being wrong with you at that time. So there's no immunity to it, but if you do have a strong immune system, meaning you don't have autoimmune diseases, you don't have underlying conditions, you're fairly healthy overall, your body has the ability to deal with it. But there are also many cases of healthy people with no underlying conditions whatsoever who have it, and they have passed away as well.
One final question that we have that's not related to mental health, and we'll pose the mental health questions to our next set of panelists. It was around, don't most people get the fever? So earlier you were talking about symptoms, and is getting a fever the top symptom of contracting the virus, or is there something else that pops up more?
So initially it felt like the fever was the thing. But what appears to be the thing right now, for most patients, honestly, we see the fever, either you have the fever, or we have people who have the loss of taste and smell even before the fever comes. And so for me, once I hear the loss of taste and smell, that's the thing that immediately sets me off, because your taste and your smell is connected to one system. It's all connected to your respiratory system. So once your smell and your taste are failing, it means that the virus has already colonized your respiratory system. And the next thing that's going to happen to you literally is respiratory distress. So for those patients, those are the ones that almost immediately, we're thinking of what can we do to deal with the potential respiratory distress that might come. For individuals who have, even if you have a fever, sometimes honestly just taking a low-grade fever medication like a Tylenol, acetaminophen can work to resolve your symptoms, because there are patients who have the fever and they have no cough, no respiratory symptoms whatsoever. So I will say that the fever happens pretty often, but the fever is not what causes us to go into a panic. What causes us to go into a panic is the chest problems, the breathing problems, the loss of taste or smell, because we know that what's coming if we don't troubleshoot is the respiratory respiratory acute syndrome is coming next.
We had two other questions, but we'll provide the answers to them in our public chat. Ena, thank you so much for answering. Your table topics answers were great for this session. And I'll now turn it back over to our host, Danielle Derrick.
Awesome.
Here we go. Thank you so much, Lisa and Ena. That was very informative. So what I've learned is no drinking bleach, no washing your hands with bleach, but it's okay to spray your children down in Lysol. Just kidding. That was very informative. And like I said, thank you so much for sharing that information, separating the fact from fiction, and just giving us answers that were very digestible and easy for us to understand and have something to take away with us. Now, we heard our story in the beginning, and I'm sure that many of you have had situations where you may be alone in your house for an extended period of time and you're not really interacting with others. You may know of other loved ones who may be in nursing homes, or they may be in a hospital, or they may be elderly, so you can't go and visit them. And you may feel just this feeling of, I'm tired, I just want to give up, I don't want to do anything, I'm depressed and I'm lonely. And so today what I'd like to do is introduce you to Sandra Coles-Bell, and she's going to help you to not only find your resilience, but how to build that resilience. So ladies and gentlemen, I'd like to introduce Sandra Coles-Bell.
Danielle, I thank you, and good afternoon, everybody. I want to invite you to take a trip with me. Don't worry, we'll be able to return here to the webinar. And don't worry, we'll maintain the safe distance. But when it comes time for me and I'm stressed, I start thinking about the water. So I want to invite you to go with me to the Chesapeake Bay. We have just passed the toll plaza. It's been stressful. It was a line. And now we're about to ascend what seems like, for some of us, the longest bridge in the world and the highest. And don't close your eyes. Keep your eyes open, especially if you're driving. But let's go up to the very top. And when we get there, let's just stop. For that moment, stop and take a look around. There are a couple of things that we're doing at that moment to build our resilience. And I particularly do it for mine. And that is, I know myself. I don't like heights. And the second thing is, I'm facing my fear. And in that, I'm building resilience. So I want to invite you, while we're at that very peak, to look around at the beautiful Chesapeake Bay. And what do you notice? Sailboats, tons of them in the bay. And they're having a wonderful time. And I want to draw your attention to just one kind of sailboat, and that is the skipjack. Now, what does a skipjack have to do with resilience? Well, the skipjack is germane to the state of Maryland. It has a place and a meaning and a purpose within the bay. And the skipjack has been in existence for over 200 years. That's resilience. It has a purpose, it has a place, And it has maintained its ability to maintain that place in all of that time and is still in existence. Well, what is it about a sailboat that has to do with resilience? Two things. One, the sail. We're relying on that wind. And the second is the rudder, the direction that we're going to take. That has to do with resilience. You see, life has created wind. COVID has created a storm. And our resilience will come when we are in control of the rudder, the direction that we are going to take to address all of this. Now, in my own personal life, I've had some storms. But I noted that as those storms come and I've learned to control the rudder, I'm doing much better. So what's the control of that rudder? Well, two things. One is knowing yourself. And again, the second one is facing your fear. And I'm going to add in the third one, loving yourself where you are at the very moment. That's where our resilience comes in. In this time of isolation, at the top of that Bay Bridge where we are, looking at our fear and knowing our fear, we also have the opportunity to take the time to really get to know ourselves. Let's find what causes us peace. Let's dig deep to try to find those things that will give us a sense of joy despite that wind that's going on. I spoke to a dear friend this week. Her joy for painting arose again. I spoke to other people and their joys and the things that they're doing to build their resilience is just getting more and more amazing. They're knowing themselves and they have control of that rudder. Now, the other thing is this week, I actually had my own additional win unexpectedly. We had a fire drill, not a fire drill, an actual fire in the apartment building in the middle of COVID. Yes. What do? Let me grab my cell phone. Let me grab my iPad. Let me grab my mask. Let me go outside. And so all of us vacated. Now, I had just moved into this building right before we went into shutdown. So neighbors I did not know. But there was one neighbor who knew himself. And for some reason, he found a neighbor who was complimentary, and that was me. He was across the street with his daughter. And we're sitting there and watching the fire trucks and the ladders and just the myriad of activities. And he's cracking jokes. Now, the thing about it is I love good humor. So he's cracking jokes loud enough for me to hear. His daughter's rolling his eyes, and he's grateful I'm laughing. It went back and forth. In that moment, I knew he knew himself. He found his resilience, and I was ever so grateful to be able to share in that. Well, we were outside a few days later, again with safe distance. And I said to him, the other day, I don't know who you are, but you must have been inside too long. He said, no, this is how I am all the time. And thanks for laughing. That's how we're going to build our resistance. We're going to have to find the things that give us joy, that bring a humor into our lives. And from there, we'll be able to get on the other side of the Bay Bridge. So I invite you to build your resistance, to understand that the winds you cannot control, but the rudder is what you do have control of. And you get to add to that rudder every time and every day to build it up. We'll get through this. I promise you. If I can take you to the top of the Bay Bridge, stop one more time the next time we're there and look at the boats. Remember the Skipjack. It'll remind you of COVID. The wind we cannot control, but the rudder that we do have control of to provide our own direction. Be well. Thank you.
Thank you so much, Sandra. That definitely enabled me to build resilience as I go through this COVID-19 pandemic in my house. Next, I'd like to introduce to you Peter Tan. He's going to provide for us resources that we can use to get through this pandemic. Peter.
Thanks so much, Danielle. And thanks to all the speakers who have come before me, and thank you to all our guests for joining us today. I'm going to go over a couple of resources for COVID-19 and the crisis that we're in. I want to stress the fact that this is more a list of lists than anything. And that's mainly due to the fact that our audience is, the breadth of our audience is so great, right? The greater DC area is so large that I'm trying to bring in as many local resources to you as I can, but don't worry about noting all of the different links that I'm about to share with you or anything. At the end of this presentation, Maylene is going to share a Word document that you can use and take with you so that you can reference these later on. So as I mentioned, I'm going to jump right into this, these list of resources. We may tend to think about COVID-19 as a binary issue. Are we healthy or are we not healthy? But the reality that we've all experienced since mid-March is the fact that this crisis has impacted every aspect of our lives, and that's something that we really need to take seriously. And there's things that we may be thinking about, things that might be in front of us all the time, and some things that we may not be thinking about. So I'm just going to go through the list here, and if you have any questions, feel free to ask them at the end or pose them through the chat. But jumping into these, as has been mentioned several times already, mental health is obviously a big concern right now. We are being asked to make huge sacrifices. A lot of us are being asked to stay home. A lot of us may not have financial security or food security or just shelter right now. And so mental health becomes a really big concern. Some of us might be isolated in our homes. So here's some links for both the DC, Maryland, and Virginia areas. As I mentioned, all of these links are going to be shared through a document at the end. I do want to talk about this briefly, and that is that if I had all the time in the world, I would go well beyond just these points in terms of DC's Board of Health, for instance. And I mention that because mental health also is something that we haven't had a lot of conversations about it traditionally, but as we move through this experience, we find that, and as we evolve our understanding of mental health, it's something that is not just put into these terms of black and white. Now we really need to think about mental health in terms of how we go about our daily lives, how we think about self-care, how we think about our fulfillment through our jobs. And if I had more time, I would have built out this list well beyond to provide certain resources that include things like free online yoga classes, free therapy sessions, free different ways that you can interact with your family, whether that be online board games or any number of other different ways that we can ensure that we are having the opportunity to connect with people, as well as find ways of not always thinking about COVID-19 and its impact on our lives. And I mentioned that It's really important that we disconnect once in a while from the news, because it is a steady stream of really sensational information. Not everything in there is critical for us to know, and we really need the opportunities to get away from that. So here's a list. As I mentioned, if you have some other resources in your area that can put you in touch with some online yoga. My wife loves yoga. She always complains about it 5 minutes beforehand. Oh, can I do this? Do I want to do this? 5 minutes after, she's like the nicest, kindest person ever. And she's like, I'm so glad I spent 10 minutes doing yoga. It doesn't even have to be a half hour. It doesn't even have to be a full hour. The next item I wanted to mention was safety at home. This is a huge concern because a lot of us have a lot of privilege and luxury that comes with being able to work from home, or some security that comes from being home and being amongst family. A lot of people face challenges in those situations in terms of domestic violence, whether that be against women or men or children. And so there are some resources throughout the region that I really stress people reach out to, or give these resources to other people that you know who might be facing issues at home around their physical health, mental health, or physical safety. But this is something that we all need to be wary of, because, you know, me personally, for instance, I'm at home very comfortable, and it's really hard. It's something that I need to remember, the fact that not everybody has this luxury. Testing sites. There are currently testing sites available. In DC, from my understanding right now, you would need a referral in order to get an actual coronavirus test. And this link here shares a couple locations that you can find in the DC area. From my understanding, and Ena can probably correct me on this, but I think George Washington Hospital also is going to be testing for coronavirus in the near future. Beyond that, Maryland and Virginia, a lot of their vehicle emissions inspection stations have actually been converted into drive-through testing sites. As mentioned prior, testing, there are limited tests, and so we don't want everybody at the drop of a hat to just run out and get tested. But if you have any legitimate concerns, ones that really give you pause when you think I have some symptoms that seem to be correlated strongly with coronavirus, the fatality rate for this is not through the roof, but it is something to be concerned about. We've had information that it's predominantly affects seniors and people who are immunocompromised, but we all need to be aware of the fact that regardless of our age, our health status, we should be aware of, if we are showing symptoms, that a test is available, and we should be able to go and get that if we have reasonable concern. Meals for students. Students obviously at this point are being impacted, as well as their parents who are teaching them at home. But food security is an issue, as I mentioned. And there are programs right now that are providing meals for students on a regular basis, just as if they were still in school. And a lot of the places that they typically would get those meals, elementary schools, grade schools, and high schools, are all generally providing drive-through, contact-free meals for students. If you are 18 or younger and you are a student, then you have some resources in order to make sure that you are able to get some food. As I mentioned, seniors and the immunocompromised are in a bit more of a challenging position with this disease. And so because of that, a lot of our local grocery stores have provided certain opportunities for those segments of people to go in with a decreased density in the store and shop and have a little bit more room and safety when it comes to shopping. So these are the hours. Again, this is going to be on the sheet. There are online options such as Instacart or what have you. And there are stay-at-home orders that, at the end of the day, we want to minimize our interaction with other people outside of our homes. That being said, my wife and I, for instance, I am in my late 30s in very good health, and I do not use Instacart because my parents use Instacart, and they have a lot of difficulty in scheduling times for delivery. They are approaching their 80s, and so they're a little bit more concerned about their health, and I want them to get deliveries. So In my position, I have the luxury of being able to say, I'm going to go and incur a little bit more risk to myself because I have the opportunity to do that and leave those windows for Instacart deliveries open for my parents and those who are immunocompromised. But nonetheless, here is a list for those groups that might need don't have the opportunity to use Instacart. Unemployment, this is obviously a huge issue. There are different types of, the PPP Payment Protection Program has gone into effect. There was $350 billion released originally through Congress, and they are going through different phases, and they'll be releasing more through the program. But one thing to be aware of when it comes to unemployment is that, number one, these lines are incredibly long. We have over 30 million people who have filed for unemployment over the last 7 weeks. So those lines become really long, and the systems have not been built to handle this type of flood of claims. And those types of large bureaucratic institutions, you cannot simply just turn. It is a giant tanker ship, and turning these takes some time. So my brother-in-law lost his job, and so he has been calling Maryland unemployment daily and trying to reach them, and it will take some time. They are increasing their capacity and bandwidth in order to accommodate more requests, but these are the best resources for you. One other thing that I want to mention about unemployment is that some people are laid off, some people are furloughed. Whether you're part-time or full-time, those are concerns. In this case, the packages that they released also, in a lot of cases, apply as well to contract positions. We know that the sharing economy and gig economy has been really predominant over the last several years. And so the bills have measures in order to make sure that those people also, when they lose income due to COVID-19, are able to recoup some of their income that they've lost. Finally, this is not a local resource, but the government has given us stimulus UI, universal income. Probably not enough. That's another discussion. But a lot of people wonder where it is. Maybe you've already seen it. My brother-in-law has already gotten his. My wife and I have not have received ours. You can go to this site to look at the status of it. If you have not received it, and let's say you are in the position where you're fortunate enough to not necessarily care whether you get this or not, it is important to go check it anyways, because there may be some challenges in terms of delivering it to you. If you don't have your direct deposit information in there, or some information is unclear, if you go to this link, it will provide you with problems with your account, why the transfer might not be going through, et cetera, et cetera. And if you are in that position where $1,200, $2,400 doesn't matter that much to you, there are many, many resources for you to donate it and give it to people who are out there who might need a little bit more. That is the end of my presentation. Before I jump off, I do want to, number one, say thank you to Ena and all the first responders out there, people who are doing just the good work of protecting our lives and making sure that we are taking care of each other. And amidst all this, it is so hard to get lost in cynicism and desperation, and we are suffering a crisis, and there are so many tragedies coming out of this. But we are also seeing some of the best of humankind. Neighbors are looking out for each other. People, I have some students who are put together a program so that high school students can make deliveries for senior citizens. People are helping each other on the sidewalk. People are helping each other with their cars. People are delivering groceries. People are supporting local businesses. I think these things are really important to keep in mind as we go through this, because when crisis comes along, that's an opportunity for people to show who they are. And you see some of the worst things. You see graft and you see corruption, but at a personal and local level, you see some of the best that we have to offer. And I think that that's something that we need to keep our eyes open in order to keep moving forward. So thanks so much.
Thank you, Peter. Thank you so much for the resources. They were definitely very helpful definitely to me, and I'm sure to the others in the audience. And as you may have noticed, some of those links are posted in the chat for you all as well. Now we'd like to introduce our next speaker, Glenda Dickinson, who will speak with us about some mental health resources as we get through this COVID-19 pandemic. Glenda, are you ready?
Yes, I am unmuted. Okay. One second. Okay. Am I here yet? I am on.
Yes, you're on, and we're
awesome. Thank you so much. And I just want to say thanks to all the people who have gone before us. Thanks to Ena and everyone who has put on this program for us today. My name is Glenda Dickinson. I'm Dr. Glenda Dickinson. Actually, I'm a mental health counselor, and I work with a lot of people who have mood disorders, who have mental health issues, who are basically struggling on a regular basis and are now faced with dealing with COVID. And COVID has hit them with a real bang, and especially those who are forced to stay indoors and they were already struggling with that. Someone asked earlier, what are some of the things we can do for mental health professionals as they not mental health professionals, I'm sorry, mental health patients or clients as they navigate this particular situation? Well, first, let me talk about some of what I'm seeing. Some of what I'm seeing is a lot of anxiety. Anxiety is a big deal at this time. My clients are not sure what's happening to them. How did they get to this point? What are they supposed to do? And the fear for the future is very real. I'm also dealing with clients who have a lot of depression. They already had depression ahead of time, and now they are dealing with it a lot more. And with that depression, the social isolation is really fueling that. Grief and loss is a big one. And not only the loss of family, and we heard from Shona, and Shona, I am so sorry. I'm so sorry for your loss. And for all of us on this panel who know people who have died or who have family members, etc. The loss is real. But in addition to the loss of life, there's loss of the world as they knew it. There's loss of income. There's loss of their ability to make choices for themselves. It's a lot of grief and loss. And so we treat grief and loss. And what is also coming down is trauma. The trauma that comes not only from the news and from social media, but the trauma that is inherent with the fear that they're feeling. I like to think of trauma, and this is the way I speak of trauma when I'm speaking to my clients. Even if your mind tells you it's okay, but your body feels different, there is trauma there. The body keeps the score with trauma. So as we think about these different issues, the question is, what do we do with our clients? How do we help them to find resilience, as Sandra talked about? How do we help them to even grow beyond where we are? Life is never going to be the same, even when we have a cure, even not a cure actually, even when we have a vaccine, life is never going to be the same. And so the first thing that I do when I speak with my clients is to ask them, apart from asking them how they're feeling, let's talk about what you can change and what you cannot change. There still is a poem, which is called a prayer, the Serenity Prayer, that sometimes I actually bring up with my clients. The serenity to accept the things that you cannot change, the courage to change the things that you can, and the wisdom to know the difference. So what are the things that they cannot change? They cannot change whether they'll get the stuff in the store that they need. They cannot change when the country will open up to some form of normalcy. Sometimes they cannot change when they go back to work or if they'll ever have money. But what can they change? What are some of the things that they can do? What are some of the things they can control and focus on? And I start off by saying, wake up with a plan. It's a sense of purpose. Wake up saying that I am going to make it through this day. I do a lot of affirmations with my clients, and I have them select affirmations that they can use themselves. What are some of the things that I can do today? And what are some of the things I can be grateful for? What good can I do? And my work is a lot with positive psychology. I work with post-traumatic growth as opposed to post-traumatic stress disorder. I work hard to help clients turn that corner and find growth. So we start with a positive attitude. It's hard to have a positive attitude when, as Peter said earlier, you're in a house with domestic violence. You're in a house with people who are not wanting to be there. So it's hard. So everything that I'm saying, I'm telling you, it happens, but it takes time. So let's start with a positive attitude. I can control that. I can. It takes work. We work hard at it. And sometimes many sessions just to get us from moving from point A to point B. Last week, I had a client who was talking about her mom, and she says, we always do work. We always have something to celebrate our mom's birthday, and our mom is not with us anymore. So guess what? She's now planning a birthday party with her siblings, and they're doing it online. So as soon as the time is right, she is going to have a party for her mother. I know a lot of times, I think Shona mentioned the funerals. The funeral is the biggest ritual that we have at the end of life. And the people who are dying are being deprived of funerals. So we talk about what can you do to honor your family member who is no longer here as part of the grief process, as part of the grieving process. We also talk about finding fun things to do at home. So one of my clients said to me recently, this is the first time in 7 years that my husband and I are home together, because they do split shifts to accommodate their children. Their oldest child is 7. And so they do split shifts. And she said, this is the first time that we are here together. At first it was difficult because we worried about how are we going to pay bills, etc. But now they are starting to make the transition to at least we have each other. At least we are healthy. We are doing things together. And we talk about turning off the news and limiting social media. As a therapist, as someone who has to work with my clients, I spend a lot of time learning about stuff in the news, because I know when they come to me, some of them come with their own theories and their own versions. And I wish many of them could have listened to Dr. Ena today, because there's so much myth that's involved with this event. So I keep pretty current with what's going on. And we talk about it, we discuss it, we talk about the pros and the cons. Social distancing is a big one. Many of the clients are not liking social distancing, and especially clients who have depression. One of the things that they had been working on is having social support, having someone who can be there for them, having someone who can do stuff with them. And now here they are, some of them live alone and they have to stay alone. So we talk about making connections, having people who they can check in with and who can check in with them on a regular basis, so that they can always have that connection, even if it's not in person. And I have introduced a lot of them to Zoom. Okay, so here we are with Zoom. Make sure that you are able to connect with people on Zoom. What else we can talk about? So we have fun things, and one of the fun things that some of my clients do is have a night when they are having their families together, and they have movie nights or they have theme nights. Not all clients are able to do that, especially the ones, as I said, who are by themselves. But so what, in essence, we do is to look at where our clients are, look at the resources that are available to them, and help them to make the best of what they have. I want to talk a little bit about post-traumatic growth, and that is something that I think is important as we think of the trauma that they are facing. And post-traumatic growth is a positive personality change that follows traumatic life events. And not everybody achieves post-traumatic growth, and it's not something that happens like we are going to sit down and get it. But what you will find is that after events such like as this, people who experience post-traumatic growth have a greater appreciation for life. After you've gone through a situation as we are going through right now, a horrible event like COVID-19 that I have never experienced in my life, and I don't think anyone in this room has as well, you are going to appreciate life a lot more. You're also going to find your priorities have changed. You know, there are people who are talking about, I can't get to the beauty parlor. I can't get to do certain things. Your priorities are going to change. And so I talk with my clients about what are your priorities right now? What are the things that are meaningful to you? What is your sense of purpose as you begin each day? What are you looking for your family? Physical health becomes a big deal. And when I talk about physical health with my clients, we are talking about simple things. Things like getting enough sleep. There are 5 of them. Getting enough sleep, eating a healthy diet, having some activity during the day, taking whatever medicines are prescribed for you, and drinking water. Healthy coping is also a big one. Also, you'll find that relationships, as I mentioned earlier, will become better. Now, I know Peter talked about having domestic violence in the house, and how do we deal with domestic violence when we have clients who have no choice. So some of what we do is anxiety management, mindfulness. Mindfulness is a way we manage anxiety. Mindfulness is awareness plus acceptance. And I'm speaking very, very fast because I'm trying to get everything in the time that I have. And mindfulness is anxiety plus acceptance. Awareness plus acceptance. So I am aware of where I am. I accept the fact that I'm here. How can I make where I am safe as I can? And so it puts a lot of burden on the person who is having to stay safe. But once you're aware that this is where I am, let me try as hard as I can. And we do something called a safety package. Have your keys close by. Know the signs. If you're living with an abusive person, the cycle of violence follows a pattern. So be able to be aware of that pattern and know when it's time to leave, when it's time to bail. And I do have a client who had to know when it was time to bail, and praise God, she was able to leave on time. Even when you are at home, some of the skills are breathing exercises and grounding, and also being able to reach. Some of my clients reach me between sessions, and I give them that opportunity. Not always would I have done that, but at this period in time, I allow them to call me, and I'll spend 5 or 10 minutes with them, and I will determine with them, should you go somewhere else or should you stay where you are? So to kind of wrap up, the coronavirus, the COVID-19, has really accentuated for many mental health issues that they currently had. And it has created for some mental health issues that they did not know that they had. Social isolation is a big deal for many people, not being able to follow the routine and the patterns and what they were used to doing. And so in addition to the loss of life that some suffer, is the loss of the life that they knew. And that has created a problem. They don't have social support. Important events are canceled. Some people were looking forward to their children's graduation. So we start reframing. Okay, they're not able to graduate. And what is the plus? How could you find something positive there? And then I'll hear things like, well, at least they're alive. At least they got into a good school. I don't tell them. I encourage them to find the positive, the underlying positive thought that comes from what's happening. Because if we keep feeding into the negative and saying, yes, it's bad, yes, we know it's bad, then, you know, we are not helping. So yes, we know it's bad. That's the awareness. Yes, we accept it's bad. That's the acceptance. Now, where do we go from here? What can we do? And so it's an active process. And I thought a lot of people are not working. I am now working 6 days a week. And I'm amazed that people are calling all the time. And it's become, you know, for me, it's my mission. So I work with my clients. I make myself available to them. I create situations where they can thrive in this event. And, you know, spirituality, and I didn't talk in that, I am a pastoral counselor. Spirituality is meeting the clients where they are spiritually, not necessarily religion, and helping them to grow from there. So I think I've said it all really quickly. I hope it wasn't too much of a rush for you guys. But the bottom line is, if you know anybody who is struggling, do not let them struggle it alone. You are your brother's keeper at this point. Check in. Call people that you haven't spoken to in a while, not just text. Listen for their voices. Sometimes you call a person and they start talking and, oh yes, I'm okay. And 5 minutes into the conversation, you realize they're not okay. Encourage them to find help. Yes, we have a health crisis. It's a physical and mental health crisis, because beyond the pain and suffering of death is the pain and suffering of insecurity, anxiety, depression, grief, loss, trauma, all a mixed bag of emotions. And we are here, those of us who are mental health counselors, we are here to help. At least I am here to help, as I could speak for myself. So that's my presentation for today, and I hope you got something from it. Thank you.
Thank you so much, Glenda. That was definitely very informative. I can definitely say that just being in the home now, I have definitely been thinking about the priorities of my life that you mentioned. And for me, prior to the COVID-19 pandemic, my priorities were my eyebrows. And so it is killing me that I cannot get them threaded. But I understand the importance of the social isolation and social distancing. And so I'm being a good person and not going. And so now I've taken on my new priority, which is just running. And it has definitely been very, very helpful, not only to my physical health, but to my mental health. So definitely thank you for that. Our next speaker is Rebecca Ahmed, and she's going to talk to us about some coping and thriving strategies. Thank you.
Perfect. Thank you so much. Can everyone hear me okay? Okay, perfect. All right, so I'm going to piggyback off of a little bit of Glenda and Sandra's information, as well as Ena's when she talked about energy, because right now we're all inside, we're all quarantining in some form or fashion, either with people or alone. And it's really hard to be true to who you are. You kind of can get lost in this sense of all of this news coming at you, which we told you, make sure you're taking that in bits and pieces and not getting sucked into the media and everything that can go into a spiral catabolic effect. But also, who are you during COVID and what will you look like afterwards? So what we're going to do, oh, you can't see me. All right, that's weird. All right, well, I don't know why you can't see me, but I'm going to share my screen so you can see my screen here. Let's see here. Share. And okay. Can everyone see this screen? Make sure that pops up. Okay. So what we're going to do is really just do a quick review of your values. So this is to really energize your why and lead with your values, because it's very easy right now to lose yourself into who you really are and how you communicate with others, especially as we start really getting back into society and thinking about, you know, how do you lead with love? How do you lead with laughter? How do you make sure you stay true to yourself and not really get sucked into this catabolic energy? So, All right, so my name's Rebecca Ahmed, as I mentioned, and I am the founder of Laugh Through Life. I'm a certified life coach with the International Coaching Federation, as well as IPEC, so I'm a certified energy leader, and I'm happy to share any information around that at a later date because I know we're short on time. But what we will do is do a quick values assessment, and what I would really love for you to do is focus on one value in the interest of time. And what you'll do is really look into how can you put this into personal action to ensure you are honoring who you are, honoring your values, as well as the values of those around you, whether you're communicating them with them via text, virtually, in person, with your teams. I know a lot of people are doing their work remotely, connecting with their family, going through, a lot of this trauma. So really leading with those values. And then I believe Q&As, you can put it in the chat at the end. So why are values so important? And it's hard to really see this sometimes, especially when your current environment is not speaking to your values. If one of your values is creativity or activity, this is going to be very challenging. But it's important to know what your values are because it's what motivates you. It is what really gets you going every day and speaks to your purpose and how you work with others. And the key takeaway, especially for those who have the value of helping others, is to accept opportunities that align with your values. So you're constantly filling up your basket rather than just giving out all of your apples and not regenerating yourself, which is so important during this time period. So what I'd love for you to do, and I'm going to flip to the next screen shortly, is we're going to review a list of values. Usually I would say pick 3 to 5 words, but today I'd like you to really hone in on one word, one value that completely describes who you are. And once you have that value, I'd like you to take a pen and paper out, or if you have your phone nearby, and define what that value means to you. And I think this is so important because what you will see is that how you define a value might be very different than others in your household, others that you're connecting with, others on your team. And it's important to understand that even though you might have the same value, you might have a different definition. For instance, community. This is such a great example right now. Community can mean that, and I've seen this with many of my clients, one person says, I have a really tight community and community is my value. But what they look at as community is a few people within a few different circles that they're very close with, and they want to make sure they have that very, very intimate interaction in their communities. Other people say, you know what, I like to know I have large communities that I can connect with, but I don't have to have that super intimate involvement with them. But I like to know if I have a personal development community I can reach out to, as long as I can reach out to them, I feel great. If I have a community of runners that I want to reach out to, I feel great. So as you can see, those are two of the same, words, value, but they have different definitions. You'll also see that a lot of times different definitions will equal different names of values. So this is, again, so important as you do this exercise with yourself, with your partners, with your loved ones, with your teammates, with anyone you interact with. This is going to help you communicate better and make sure you're aligning your values with each other. And what you'll do, and we won't do this today, but this is a takeaway, and we'll share this in the information after this webinar, is really rate yourself. How are you honoring your values? And I think this is so important during COVID because you see a lot of catabolic energy out there. Even on this webinar, some questions come out and they're like, ooh, this is spicy, or what's coming out here, or whatever that might be that's stirring up some fear. This is really going to help you get redirected back to who you are, anabolic energy, and a focus of your values and how you can really be such an amazing positive force for yourself and your community. So here are a list of words. I'm going to leave this up here for about a minute. And I'd love for you to go through these words and pick one today, just one, that will say which one really honors my values. Okay, perfect. I saw the chat too, so we're all good. All right, so I'm hoping everyone has at least one they can pick right now. I'm going to do mine so you can see how I go through this process. One of mine is walk the talk. So now that I have this one value that I really truly believe in and I know it honors me, I need to define it. So now take your word and define that. When I say walk the talk, for me, If I say I'm going to do something, by goodness, I'm going to do that, come hell or high water. And when I hear somebody say, oh, I'll drop off this, or, oh, let me get you this, for me, that means they will walk that talk. Now, that does not mean the same thing for everyone else, and that's why it's so important when I have these conversations with other people that I interact with, they understand the power of my value and my definition versus theirs. So what I'd love for you to do is really write down, what does your value mean to you? And now that you've defined that, how are you living in that value? And how has COVID potentially removed you from that value? If one of your values, let's say, is humor, and you're not laughing every day, I mean, my company's called Laugh Through Life. If I don't laugh every day, there's something very wrong. So how are you not honoring those values? Because it's so important to get you back to reality, back to who you are and your roots, so you can thrive even during this pandemic, even during times of stress. So I'm going to give you another minute to wrap that up. And so what you will do, and again, we'll post this after, is take this review of this value or any other values you want to add and say, what is the most recent challenge that caused you to deprioritize one of your selected values? Are you not laughing because all you're looking at is the news, and you should probably put in some comedy shows or connect with people that bring you joy? Why did this challenge become more important than your value? It's easy to say right now, we have a pandemic. It's so crazy out there. We're in this COVID craze. But again, what is a way you could have honored that value that you didn't see? And this is the opportunity for you to jump into these blind spots and say, okay, I wasn't seeing this, but now I have this opportunity to jump into action. And that's where we're going to go, because here I am very action oriented. And this is about jumping into that action. So what I would love for you to do is be accountable to yourself today and jump into that action. What will you implement to begin honoring your values, even during COVID, and even more importantly during COVID? And when will you begin? Put a date to that. Connect with everyone you're connecting with in quarantine, people virtually, your teams, etc. Do this exercise with them, because you will be able to communicate so much more efficiently and effectively. And at the end of the day, really honor each other's place and have beautiful and fierce conversations to move you forward in an anabolic and positive energetic state. So that is my message today. I hope everyone really got a great takeaway. We will share the resources. You can dive into this and have such clarity around your values to have effective communication skills, and really just be so grateful to yourself right now, because this is a challenging time, but you've got this and you can continue to thrive even in challenging times. So thank you so much.
Thank you so much. That was definitely very informative. I think my value word I'd like to use is trust. We're in a time where we need to trust our leaders. We need to trust our medical professionals. We need to trust those around us to wash their hands. There's so much that comes with that. So definitely thank you for the exercise. It was definitely very helpful.
You're welcome.
We are currently at the end of our programming. And I hope that you all found this definitely informative. We had a personal story from Shona Bramble. We separated the fact and fiction so that we could walk away to make better informed decisions about not drinking bleach, among other things, but also cleaning our groceries with a little bit of soap and not a bunch of soap. We also had a great interactive session and found out how to build resilience. And then we also had the resources that were provided to us. And we will be posting those resources very shortly to the She Leads, She Speaks website, as well as a copy of this recording. If you could give us maybe about a week or so, and we'll definitely have that posted. And then lastly, two of the things that I think are important, which are definitely mental health and coping and thriving strategies, very important. So thank you to all of our speakers today. You definitely made me walk away feeling a little more comfortable with what's going on within this pandemic. All of the presentations as well that we saw today, Dr. Ena Okah's and Rebecca Ahmed's presentations will be posted as well for you to view those. And with that, I would like to close out our session for today. Thank you to our speakers, those individuals behind the scenes, and especially our audience. If you would like to chat with someone from this session, you could definitely put your email in the chat section so that we could get your email information as well. Thank you all and have a great day.